Okay, so I think we'll begin again. So welcome back everyone to the second half of the VSSN Volunteering in Health and Social Care in the context of COVID-19 day seminar. I hope you all have had your cup of tea and ideally a slice of cake. Unfortunately, I didn't quite manage to find a slice of cake in my cupboard. I very much wish we were all together in one of the normal VSSA day seminars where they will all be provided for us. But hopefully you've had better luck than me and managed to find that cake in your own homes. We had an excellent session before break. We've got an equally excellent session this afternoon. We're going to hear again from two speakers. This time from Jane South, who is Professor of Healthy Communities at Leeds Beckett University, and then from Mike Locke, who is Honorary Research Fellow at the Centre for Philanthropy at the University of Kent. Both Jane and Mike have got, I hope you don't mind me saying, many years of experience of research within the context of volunteering in health and social care. Very much looking forward to both presentations, so thank you for being with us today. So Jane is going to kick us off, and Jane is going to talk to us about a piece of research that she's been involved in with a title of the session on Moving at the Speed of Trust, Mobilisation of Volunteering in the Context of Health Inequalities and Need. So Jane, over to you. Same as last time, I've got 20 minutes for presentation, then we're going to have question and answers across the two from the two speakers at the end. So over to you, Jane. Thank you very much indeed.
Thank you, and thank you for inviting me to this session. So I'm going to take a public health perspective on volunteering in COVID. And I'm a sort of rare breed really, because I'm a public health researcher, but one who's interested in volunteering and the role of communities in health. And before I go on to talk about volunteering in COVID, in the context of COVID, I'm going to just start with a couple of things that have shaped my thinking on volunteering and public health for quite a while. So what is public health? It's certainly been in the news since February, every single day, had a huge prominence, but it's defined as the science and art of promoting and protecting health and well-being, preventing ill health and prolonging life through the organised efforts of society. So it tends to focus on population level interventions, on prevention, particularly working around the sort of factors that underpin ill health, rather than just the sort of what happens when people get unwell. And it also is very collaborative and interdisciplinary. But the question that I've been wrestling with for a lot of my career is, where does volunteering fit with it? So I've been arguing, there's a few of us who do this, but not that many, but volunteering is actually a public health issue. And thinking about this pre-COVID, volunteering has the potential as a population level intervention, thinking about how many people do it, to support better health and well-being. And this is through the individual benefits of volunteers and their sort of beneficiaries, but also because it creates sort of more connected, more sort of enabled communities. And those factors operating at a community level, whether people are isolated or, you know, have good social relationships, are really powerful factors on our health. Volunteers, another really important part of it from a public health perspective, is volunteers can connect to at-risk groups, and that extends the reach and uptake of public health programs. And some of you may not know this, but they're actually considered part of the wider public health workforce. So they're in the skills frameworks and so on. But there are huge questions about how all groups, but especially those who experience socioeconomic disadvantage or social exclusion, can benefit from volunteering, from being sort of volunteers, and the barriers to that. So really, taking a public health perspective, you can think that volunteering is socially patterned, we know that, which groups tend to volunteer more and which have sort of faced barriers to it. But it also at the same time, paradoxically, offers a means to mitigate some of those factors, because some of those, the relationships, you know, around sort of social connections and empowerment are very powerful protective factors for health. So just to draw very quickly on some research, which now seems a while ago, it was about 10 years ago, but just to illustrate this around the volunteer roles around bridging and connecting in health. So these two quotes come from two public health projects that are markedly different on the surface. The first from a public health project that was dealing with screening over HIV and sexually transmitted infections with the men who have sex with men community. And the second is a neighbourhood volunteering, really, around health promotion and a regeneration project. But the two things that come out of these quotes, which were seen throughout a lot of this sort of much bigger study around public health roles, was that volunteers use social networks when they're in these public health promotion projects. And volunteering is characterised by the sort of agency of the volunteer in those social circumstances, that they're seen often as quite independent and different from statutory services, and often a need to navigate those boundaries. And sometimes where you get sort of resistance to authority, and this very much relates to some of the COVID stuff, that volunteers are very much sort of bridging between those sort of roles. They can get places that other people can't, and that's incredibly important for public health. So keeping those things in mind, I want to turn to the pandemic now. So just a sort of reminder, one of my heroes, Dr. Hans Kluge from the WHO Regional Director for Europe. But this quote, I think, is really says such a lot. It was early in the pandemic, but really all communities must be supported to deliver interventions to ensure older people have what they need. Remember, we leave no one behind. If you feel your community needs support, it's the time to step up. So the public health response in Europe, across the world, and in the UK has been really defined by this public response, by volunteers stepping up. And it's from a sense of mutualism and solidarity, which is incredibly important in the pandemic. And I've sort of written about this, reminding, the public health community how important this is at whatever level for the pandemic response. So, and you see this in the UK, just to reflect some of the statistics, you probably know a lot of these, but early on after the first wave, 80% of people through the ONS survey thought people were doing more to help others, and over half of people said they'd checked in on neighbours, informal volunteering, who might need help at some time. But this solidarity and mutualism is in response to incredibly high levels of need. So by the 3rd of July, over 1 in 10 adults, and this is the same national survey, reported they found it difficult or very difficult to pay the usual household bills due to the pandemic, compared to 1 in 20. And the Trussell Trust, which is runs a network of food banks, but is not the only food bank provider or food bank organisation in the country, have given out a staggering 1.2 million food parcels up to September 2020. And this is often in response to extreme social or economic need. And I think some powerful messages there. So if we try and think about a public health perspective on COVID, what we are seeing, and you will all have been aware of this through the news report, is the inequalities that have been exacerbated and exposed by the COVID pandemic. And colleagues in Newcastle, by Claire Bamborough, have talked about a syndemic. So this is where the sort of the interaction between socioeconomic inequalities, the inequalities in chronic diseases that people often suffer much earlier in the poorest communities and communities that are sort of marginalised, sort of mesh together to produce this, and the pandemic, to produce this sort of unequal patterning of the of people's mortality, the rate at which they get COVID, but also some of the sort of need that's exposed during communities. So I'm sort of thinking, well, in this sort of very mixed world of all these different factors, where does volunteering and community action sit with that? So we can't just see that as sitting alone and some sort of accidental, spontaneous activity on the side. It's part of that picture. So I haven't got the answers to this, by the way, so I'm just sharing with you really some of my thoughts, because I think it's so sort of interesting, but also so much evolving. But I mean, one of my thoughts I've been having is this sort of notion that volunteers just organise by themselves, which sometimes happens, doesn't it? But in some of the communities that have been most impacted by COVID and by inequalities, there you see many positive examples of mutual aid in these communities. And the key factor in that is those grassroots organisations or community anchor organisations who, as this quote says, which I've used as the title for my presentation, can move at the speed of trust, because these are often the areas that are repurposing their activities, and particularly in those sort of more disadvantaged neighbourhoods, and can get out to people, and volunteers are sort of changing their roles, and sort of they're already in a really good position to do that. And I think they've been critical in the public health response. And this report, which I really recommend if you haven't read it, but argues that community spirit is everywhere. So we should celebrate this sort of self-organisation of communities, community organising, but we need to recognise that to sustain that, some places will need more support, because that, you know, the resources that go into those communities are often sort of much less than go into more affluent communities. I've also been thinking a lot, particularly recently, about the public health volunteer roles that volunteers are doing. So the obvious thing at the beginning of the pandemic, which is what Hans Kluge was talking about, is that volunteers have enabled a support to those who are shielding or self-isolating by typically doing things like delivering food parcels, collecting prescriptions and so on. That's been incredibly important to the pandemic response. They're also involved in communication of health messages, outreach, organising support, reducing social isolation and promotion of good mental health and well-being. And we heard a fantastic example of that this morning, and helping people connect to the right services and support. And you're seeing an increasing recognition, I think, that volunteers in the community, often in quite informal ways, can become sort of key to this pandemic response, because it's been so patchy that the response in different areas, this centralised approach hasn't sort of worked. But you hear the example in Dudley becoming a COVID champion, you know, step up, spread the word in your community. And it goes back to that thing I was talking about in public health, about this sort of key role of volunteers in acting as bridges. So to sort of draw that together, I think we need to understand the changes and challenges in the pandemic if we take a public health perspective on this. We need to recognise the positive, the huge volunteer response and the adaptation that's gone on, the critical role that grassroots organisations have had in coordinating that, particularly in relation to social and economic need, and the opening up of public health roles for volunteers in response and recovery, and then perhaps a little bit also about digital connections, which I haven't got time to do. But on the other hand, we need to recognise the challenges, the situation, which I think has already been talked about the sort of massive adaptations had to go on because people have been stood down, stood back, come back, had to change what they're doing. How does that impact on people's well-being as volunteers? We need to think about whether existing inequalities in volunteering, because it's socially patterned, if you're more healthy and wealthy, you're more likely to volunteer. How does that work out in the pandemic when all of these things are much more difficult? Then thinking about the high levels of need, other types of social exclusion, and how we sustain that response in a way that's equitable, so we're giving the resources to those who need it most. So I'm going to finish my last slide really to say that we need to, that where I've got to with all of this, my thinking, because it's been very rapidly changing, is to sort of understand what I think we need to understand better. And I apologise, I haven't got the answers to it, but we need to understand clearly the nature of changes and challenges, and that's what the IVR and many people in this room are doing. I think we also need to understand the intersection between inequalities, volunteering and the pandemic, because there's something very sort of big going on here and we do need to understand it. But also we need to recognise and understand the value of community volunteers as trusted individuals who can reach out and connect with the people and communities who are most underserved and most impacted by the pandemic and its consequences. And why do we do this research? Well, for me, because the better understanding will help shape more effective and equitable and sustainable support for volunteering in the pandemic response and recovery. And that's the kind of nub of why I think we need this information. But I'll end there.
Brilliant. Thank you so much, Jane. That was such a fantastically useful kind of overview of things. And I kind of completely agree with your kind of concluding thoughts about both the questions that it raises, but also the urgency and then the need to do this. So thank you very much for that. Just to share a reflection that's coming in from the chat messages. So others are agreeing with that. So Matthew Cobble, for example, has said, totally agree, the connection between volunteering and an active lifestyle and the benefits that this brings is not as discussed as widely as it should be. And I guess by implication, it should be discussed more. And maybe that's something that we can talk about more during the discussion. So thank you very much for that, Jane. We'll save the questions for answers. So please do remember to be putting your questions into the Q&A box now, and we'll save those for after we've heard from Mike, and then we'll take them across both speakers. So without further ado, I'm going to turn to Mike Locke now. So Mike, over to you, please. You're going to need to unmute yourself. The joys of Zoom. Are we facing issues?
I'll try and unmute you. Hang on. No, I can't unmute you from here.
Bear with us a minute, everyone. I'm sure we're... Oh,
can you hear me now?
Yeah.
Can you hear me now? Am I here on now? Yeah.
Yeah, that's great. We can hear you now. Thank you.
Okay, sorry. I was got caught up in trying to share my slides. Excuse me a minute. Does that now show as the slideshow?
No, we're not getting it yet.
No.
I don't think you've hit the share the screen at the bottom.
I have, yeah. Okay, I'll have another go.
You're sharing. You can email them across to me quickly if you want to, and I'll see if I can share them. But
Jürgen has got them as well.
I should have them, so...
Sorry.
Mike, do you want me to have a go?
Please, that would be a good idea.
Okay, don't worry.
Caught up in this.
We've been doing so well so far, though.
Sorry, yes.
during the course of the day. There we go.
Thank you.
Hang
Am I
on.
going to...
Yep, hang on.
Okay, you're doing it.
This is why we have a technical host in the background as well.
Thank you, Jürgen. You saved me. Thank you very much. Okay. Well, apologies for that stutter at the start then. What I'm seeing myself as doing in this presentation is talking from the side of practice, as it were, the perspective of the practitioner, and the role of the practitioner, which I've adopted for this purpose, is that of what's real for me, actually, a board member, a trustee of a volunteer centre, a local infrastructure body. I am a trustee of the Volunteer Centre Kensington and Chelsea, but I should be clear that I'm speaking as myself. I'm not speaking on behalf of them. And so what I want to do is to briefly explore some of the different discourses or paradigms that have become more apparent, I think, during the COVID pandemic, and to raise some questions about how we'll look back on this. Can we go to the next slide, please? Thank you. So this is really in very broad terms. We have, I think, established what is fair enough to call a dominant paradigm in health and social care, of seeing volunteering as a service to the recipients, the people on the receiving end of health and social care. And I mean, I played my part in this when I was working for Volunteering England and NCVO, in focusing on the service aspects of health and social care, and identifying the numerous roles that volunteers undertake in the health service and in other aspects of social care, roles that are defined by public and charitable organizations as part of their workforce. We identified hundreds and hundreds of roles like that in Volunteering England, and we used that as part of the process of promoting the value, the worth of volunteering in terms of public and social policy. And I mean, it was everybody, it was a whole group of us collectively doing this. And we built up a body of knowledge and good practice to guide the recruitment and management of volunteers in these kind of situations. And I should say, I was going to say confess, but actually perhaps I should say boast, with Rob Jackson and Eddie Hogg and Rick Lynch writing the complete volunteer management handbook that kind of brings all this stuff together. And I'm sort of wondering, if I had to help rewrite it now, how would it be different? Because the consequences of the pandemic, I think, have been quite profound on this view, this pandemic. It's almost been knocked sideways by the pandemic. I mean, first of all, in the ways that Heather so vividly talked to, the lockdowns have required some volunteer activities in which volunteers have been prominent to be closed down, shut down. Many volunteers themselves have had to shield, particularly during the first lockdown, and there are hundreds of thousands of volunteers. I mean, I think it's possibly a bit shameful of us collectively not to know more about what's happening to all these volunteers at the moment. And Heather was talking to some of the negative effects on people. So that challenge to the service paradigm of volunteering from the pandemic, leaving lots of volunteers in limbo. But the two kind of aspects that I wanted to go on to the next slide, please, see as the challenges of this were kind of different paradigms of volunteering. What happened for me was, and how I got into this, was sitting in the Volunteer Centre's Board of Trustees on the 23rd of March this year, and suddenly the chief executive is talking to us about mutual aid groups. And I thought, what on earth's going on? I haven't heard mutual aid as part of the discourse of the voluntary sector for some years. And what sort of groups are these? And so I started kind of sort of following up things and trying to find out what was going on in a fairly sort of practical observers kind of way, realizing that within a few days then numerous websites have been set up to support mutual aid groups, to inform mutual aid groups how to operate, to inform potential clients how to contact mutual aid groups. And mutual aid groups were recruiting people in their hundreds within days. This was a huge outburst of volunteering and volunteering activity. And I thought, well, what is then mutual aid? I mean, and the first literature that I turned to, I guess, fairly sort of, crudely in a way through Googling and usual sort of beginnings of a literature review, was to find an American literature on mutual aid, which, as I'll say in a moment, I don't think is wholly appropriate. But I've just finished reading a book published in last month by Dean Spade, who teaches at Seattle University, called Mutual Aid. It's a guidebook to how to run mutual aid groups and the contribution of mutual aid to society. And he defines mutual aid. He says, in the face of the kind of disasters and crises we face in our society at the moment, more and more ordinary people are feeling called to respond in their communities, creating bold and innovative ways to share resources and support vulnerable neighbours. And then the particularly significant sentence, I think, this survival work, when done in conjunction with social movements demanding transformative change, is called mutual aid. I don't think this is the definition that we all share, but by any means. And behind that, I can find explicit theory drawing from experience in protest and disaster relief efforts in the United States, which is explicitly draws on Kropotkin's mutual aid work from the beginning of the 20th century and is explicitly anarchist in its theory and practice. Particularly, I recommend to you Scott Crow's Black Flags and Windmills, Hope, Anarchy and the Common Ground Collective, which looks back as his contribution and his comrades' contribution to the rescue work after Hurricane Katrina in New Orleans. They look back also to the Black Panthers social programs and various forms of collective and non-hierarchical struggles against inequality in the United States. And the slogan that most comes out of this is solidarity, not charity. It is, on my reading, a slightly partial reading, and it is a partial reading of charity that emphasizes its hierarchical and from the rich to the poor and from the powerful to the unpowerful and so on aspects of charity, rather than as charity seemed to me as a practitioner to be just a kind of convenient legal form that you had to use. Perhaps I overemphasize that. But here you have a clear statement of a theoretically, ideologically grounded movement, which is creating and encouraging groups to form a community level to work in equal and non-hierarchical ways. And in a way, perhaps in thinking about Jane's point about the syndemic, this is, approaches the kind of the range of the ways in which structural inequalities in society as well as health inequalities go together. It's not, though, I think, quite what most people mean by mutual aid in their experience in Kensington and Chelsea, however. My tentative theory is that there's a number of people who have adopted the term mutual aid in this country who have been influenced, or at least have known about mutual aid in this more anarchist sense, but it's not immediately evident. In trying to find out about it, Jürgen and Michael Ash, the CEO of the Volunteer Centre Kensington and Chelsea, and myself have been doing a case study in Kensington and Chelsea of mutual aid associations and how they were formed and how they work. I've got to say that we're not ready to report. We're in the middle of collecting data and analysing the data. But my observations from this and from more broadly are that this is really quite different. It is the same kind of feeling in some ways of people at a local level working together, but it's much more kind of brings out what we have been calling in some ways the expressive values of volunteering, the importance for volunteers of expressing what they want to do. It's consisted of people, and it's particularly important, I think, in some cases that it's people on furlough who have been wanting to help in their communities, who've been wanting that sense of belonging and having a purpose in the pandemic. And it's also, they've shown that their associations and organizations can move faster than local authorities and established voluntary organizations and have the kind of effectiveness that Jane has just been telling us about. Let's shift to the other slide, please, because this is my kind of question in kind of a practical terms. I mean, let's suppose, it's a year from now and we're at the board table in an infrastructure organization. It might be November 2021, or it might be a bit later than that. And we're thinking about what it is that we see in, broadly speaking, volunteering around the local community. I mean, hopefully, the greater part of the kind of formal volunteering in health and social care, what I very broadly described as the kind of the service pandemic, that kind of volunteering has restarted, we hope. We don't know how many of the volunteers who are presently in limbo will actually pick it up again, of course. We don't know how many volunteer involving organizations will have invented or reinvented new ways of working in terms of the regulations of the crisis. But we'd expect the focus on service, on good practice in recruitment and management, perhaps a bit modified, will pick up again, and that in a sense we'll feel life has gone on, although there must be fears that it hasn't. I mean, probably by then it'll be complemented by some kind of national volunteering force, possibly using loosely militaristic metaphor, discourse. And I mean, if you take Danny Kruger's report seriously, there might be something like a national volunteering reserve with volunteer passports, which provide a kind of license to volunteer, so that, as it were, a force is being readied for volunteering when the call arises. It will be reinforced as well by whatever develops out of the NHS Volunteer Responders Programme and the Good Sam app, which will be continuing, I guess, as what you might perhaps not very complimentary. Well, I don't know. That's what you might think. It's almost like a kind of using the technology as an Uber of volunteering. It enables people to do volunteering when they're ready to do it and to meet immediate needs. And then there will be some carryover or learning and from the experience of what I had as the lowercase mutual aid groups, the focus on the grassroots organizations that we know in our communities, recognizing more the kind of expressive values for volunteering, the importance of their own sense of belonging in the community, their own connection or reconnection with the communities. That'll link in, I would guess, to things that have been going on anyway in the past 3 or 4 years in talking about the hyperlocal aspects of importance of volunteering, encouraging people into direct, in some ways informal volunteering, neighbour to neighbour or within the streets where they live. And perhaps digging back a few years into all that work we did around the turn of the century into user involvement and the importance of participatory democracy in charities. That aspect, I think, of focusing on the sort of the community base of volunteering might well have to be thinking about how it can work with, perhaps this is projecting too far into the future, some kind of government policy which it might well call place-based volunteering. So whether they'll manage to bypass local authorities in setting up place-based volunteering strategy, I can't imagine at the moment. But there's going to be some complicated politics here. There's a big move for many more decisions and strategic issues about public health to be made at the local authority and the community level rather than at central government level. And considering central government's record in terms of volunteering and the pandemic, I think that's can be seen as quite justifiable. And there might be too, looking this year ahead and sitting at the board table, some groups which are firmly still committed to the mutual aid with the kind of capital letters, drawing on the anarchist tradition. Perhaps it'll, in a way, for some people, be showing sort of anarchist theory has worked, that people have combined, have helped each other and carried on. And in the process, they've learnt ways of working with each other in non-hierarchical, more equitable ways to change, to transform social and community relationships with benefits for the well-being and health of everybody. It might actually be strengthened by some forms of social enterprise as well, to come down to sort of a more mundane level perhaps as well, and to some theories of participation that we have had kind of running around in our discourse for some time. And so I suppose you'd wonder then, what is going to be the sort of, where would you stand as a kind of local infrastructure body or a policy-oriented practitioner like myself at that position? I mean, at the board table in a year's time, would you be seeing 3 distinct paradigms? The service tradition still operating strongly in health and social care as it has for decades. Would you be more interested or more needing to focus on some of these paradigm shifts into volunteering and as mutual aid and as community level volunteering, and as place-based volunteering? And if you were thinking of these, it was easy to pick on the word paradigm here, but if you were then thinking of these in Kuhn's sense as a kind of paradigm shift, one of the parts of the kind of the Kuhn argument is that different paradigms, I think the word are incommensurable, if I can say it right, that these different kind of paradigms of working and theorizing are in some ways using irreconcilable accounts of reality. They're different ways of seeing things. They're talking in different terms about volunteering, and they're suggesting different ways in which volunteering and community action and all the other stuff like that can be measured and assessed using different methodologies. They're tackling, are they, different social, political and theoretical problems, and they're calling for different kinds of support from local infrastructure and more broadly from the state. So is it going to be like we're wrestling, juggling, trying to work through some very different approaches? Or are we going to sink back in a year's time and think, well, actually, it kind of all worked together? Maybe it's a kind of tapestry of different threads, to use a kind of homely metaphor. And it's only kind of researchers who feel the need to disentangle the threads, but there is a way of seeing all these different things as complementary. We're all in it together. Thank you. That's my contact details come up on the final slide. Thank you, Jürgen.
Brilliant. Thank you so much, Mike. And I liked the way that you talked about those different paradigms there and thinking about whether they were kind of contradictory or complementary. I think that's a really useful kind of question for us. And I guess for me, it's that thought about whether kind of whose paradigms are they almost in terms of this is how we see the world, but it's not, I don't think it's anything new, as you were saying, for volunteers to be engaging in that way. It's always been an expressive thing for volunteers. It's just how the way that we've come to think about it in a much more kind of service orientated way. And for me, one of the things one of the positive things that can hopefully come out of the pandemic is a recognition that volunteering is much more than that service paradigm, that it is about all those other things that you were talking about. So thank you for that. I'm sure there'll be lots of kind of questions and discussions afterwards. So please kind of put your questions in the question and answer box. We're going to open up now 2 questions to both Mike and Jane. So please put them in there. There was a question there a moment ago, but it appears just to have disappeared out of my sight. So I'm not quite sure how that has happened. So if you had your question in there and would like to re-ask it, please do put it in there. Sorry, I can see it now. Jürgen has jumped in and done something, but I can see it. So it was a question. I think maybe this is because Jürgen has put some statistics in the chat function, but someone had asked about whether there's any data on the demographics of volunteers taking part during the pandemic. And we can see that Jürgen has put in there the link to the latest Community Life survey, which was a recontact survey that they did. So it's not a continuation of the Community Life survey, as we know. It's been a kind of special recontact survey that they've done during the pandemic, but that does give some of that demographic data. But any reflections from either of you, Jane or Mike, in terms of who's been engaging in volunteering and how your reflections, not necessarily statistically, but just in terms of your perceptions of who's been getting involved and whether there's been a shift in that. And Jane, you were obviously talking about kind of who accesses volunteering and who doesn't, the inequalities that we know exist within volunteering, and whether you've got any reflections on whether they have been maybe reinforced by the pandemic, or in fact kind of shifted through the pandemic. Any reflections?
Yeah, well, I'm not sure we know that yet, but it's what I think we need to find out, definitely. I mean, we do know that people's roles and how much they volunteer and whether, you know, all of that has been this huge sort of disruption, hasn't it? The pandemic's been a really disruptive event in volunteering. And as much as people have sort of stood up to volunteer, there have also been people who haven't been able to volunteer because they've had caring responsibilities or because they've, you know, been in the at-risk groups and so on. So I think that we know that it hasn't stood still. And I think what's important about that is that people sort of argue that we need to look at more than numbers, because otherwise what you get traded on many well-meaning websites is so many thousands of volunteer hours have been done. But actually we do need to sort of dig into that a bit more and understand how that's sort of happening and what things may, you know, one of the things I agree with Mike about it, I think that hyperlocal volunteering has maybe had a bit of a renaissance because that's where people have kind of centered their sort of core life at the moment. And to understand whether the pandemic's enabled that in any way is sort of, well, it clearly has on one level, but has it opened opportunities up for people who perhaps haven't been able to volunteer before because of caring or work responsibilities? I think that would be really interesting to find out.
Thank you.
I think we really need to know. Actually,
yeah.
I don't think there's kind of any data, and I mean, I don't think there's any data evidence at all about how many of the people who are volunteering in, let's call it loosely, mutual aid groups are people who previously were volunteering in other ways where their volunteering activities got shut down. Mm-hmm. I mean, it's clear from various anecdotal evidence and is that a number of cases it's people on furlough who weren't volunteering before and have actually brought kind of professional skills into running and actually setting up kind of the technology that's needed that's used in mutual aid groups. And so it's I think that the could be questions about the kind of the sort of in terms of this title here, I suppose, the equalities of people within groups and within associations. I mean, it's reciprocal and mutual in the sense that people are helping each other, and some of those people need help. Some people need help themselves. Sorry, that sounds a bit pejorative. I didn't mean like that, but as well as helping others. But and I think probably we ought to dig back actually into, whilst mutual aid has, and this kind of community-based volunteering is so much coming to the mainstream discussion during the pandemic, we ought to be looking back at over a longer time scale at the ways in which different communities have supported each other anyway.
Yeah, thank you very much for that. A question that's come in from Matthew Cobble around the paradigm shift. So I guess for Mike, but also Jane, I'd be interested in your kind of responses. So in light of a suggested paradigm shift and changing environment, is the role of volunteer manager less important because people are looking for less structure, more informal opportunities, etc., or is it more important than ever about creating a sustainable involvement, promoting lifestyle benefits of volunteering, etc.? So any reflections on the kind of the role and the status and importance of volunteer managers in the current context and going forward? Mike first, and then I'll turn to Jane.
Well, I mean, one of the problems has been that a number of volunteer managers were furloughed, which means they weren't in the position to look after their volunteers whilst the volunteers were being inactive and in need of support. We need to think much more about the well-being of volunteers in this kind of context. I suppose in a kind of purist kind of way, the sort of the mutual aid group that's based on WhatsApp and Facebook, the management is a very kind of straightforward administrative process of saying, would you could do this and do that, or broken down to an even simpler level on the Good Sam app. And so there's not much role for much space in that kind of system, even for somebody to be managing volunteers and be concerned about their welfare. But I think this would be an illusion to suppose that volunteering, can carry on, as it were, like this. Presumably it suits some people to do this. That actually this really suits their life to go and pick up a prescription for somebody occasionally and do some immediate help and feel they've done the task, and they don't really want to be looked after. But we need to think about it some more.
Thank you. I guess particularly if we reflected on this morning's presentations and the conversation about emotions,
yeah,
it kind of highlights that need for that. Thank you. Jane, did you have anything you wanted to add?
Yeah, I mean, I think I can't sort of comment in a sense on, different situations require different sort of roles, don't they? But in terms of the learning and principles of volunteering management that have been built up over the sort of decades, and it's not my area of work, but I just sort of like to say that I've got enormous respect for that work that's been done on that. Those principles need to be taken into those situations where people sort of new things are emerging and everybody's sort of, it's the shiny new thing phenomenon, but those principles need to be there, particularly when you're thinking about the ongoing like winter pressures in the NHS that will, it's not just an immediate response when everybody just got on with it basically in April and May. We're talking about it perhaps going on 1 or 2 years and then the sort of, the health and social need that will emerge from that, which I think Heather was talking about around dementia this morning. So I think those principles and learning need to be kind of kept very much so.
Yeah, I think that's a good point, isn't it? About this not just kind of people starting volunteering, it's how you sustain it, particularly as the pandemic is going on for so long. It's kind of a question of how you sustain that. Another question that's come in, always a favourite question. What is your opinion about using the word volunteer? So that, of course, as we know, there's lots of people who see themselves as helping out and would never call themselves as a volunteer. So kind of reflections on that, and maybe particularly reflections on whether that's something which is changing. Maybe partly to do with the kind of profile, I suppose, that volunteering's had during the pandemic and indeed over the last few years. But any reflections on the use of the word volunteer?
Well, in public health, I can talk about in public health terms. In public health terms, I've never had, I've very rarely until this year had conversations about volunteering in public health, because it's not, I mean, people obviously recognise the word volunteer, but it is sort of not central sort of word that's used. And in a lot of the community projects, the public health projects, people are just called either by the particular role that they do, or where you've got this sort of neighbourhood community development, they're not called anything. So, but obviously we need, you know, the definitions of informal and formal volunteering are important for being able to sort of develop a knowledge base for this and so on. So I don't think the sort of term is that we should be sort of too hung up on it, really. But we need to understand what's, you know, that it's different from caring, and we, you know, we need to sort of keep to those sort of agreed definitions and so on. But I think the one thing that does matter from a sort of public health point of view is that I think a lot of people who've had some of the sort of been impacted most by some of the sort of worst aspects of, you know, poor education and poor housing, you know, poor jobs and so on. Well, I think my experience is often some of the public health schemes that have been really successful in involving them have not gone out and said, oh, do you want to be a volunteer? They've gone out and said, do you want to share your life experience? And they built people's confidence to participate, and that those boundaries of whether you're a volunteer, a recipient, you know, what you are, it's just that you're starting. I think the Centre for Ageing Better uses the term community contributions, and I think that's probably very important, that we take an inclusive view of how people contribute.
I kind of feel kind of quite sort of unable to kind of contribute any more to this. I've talked about it so many times. I mean, I just kind of think that it's just an easy term, and it depends what label you put on things. But as Jane says, in bringing people into what we might in policy or management terms call volunteering, we would use all sorts of different words. I think actually the word, I mean, just from a totally unresearched kind of observation over the past, I don't know, several years, that volunteer is a much more usual word in ordinary discourse and in kind of media and so on than it was. And it doesn't seem such a kind of stuffy, is that the right word? I don't know, narrow term that it once did. And people readily talk about volunteering. And I would have just gone along with that, I think.
Thank you. I can see there's no more questions in the Q and answer box, but I can see there's lots of comments in the chat function, which I haven't been able to kind of keep a close eye on. But I think what I'll do is, it sounds like there's some really interesting discussions there in terms of people's own experiences and reflections. So what would be really good to do is if we could kind of stop now for our break, but if I can encourage all of you who've been posting your reflections in there, what we'll try and do is when we come back in to the panel session after the break, as I said at the beginning, we're going to invite you all to kind of magically become present on the screen. We're going to promote you all to be panelists, so we can then open up the discussion and have a much more kind of fluid conversation amongst all of us present at the seminar this afternoon. So please do save those kind of reflections and thoughts that you're putting in the chat box, and come back after the break being kind of prepared to share them with everyone in the group, so we can kind of use them as a way to build the conversation. So thank you very much indeed to Mike and to Jane for two really fascinating presentations. Thank you, really insightful, and kind of able to draw on your kind of experience in that way has been brilliant. Thank you. And thank you to all of you who have posted questions and who've joined in the discussions and have been sharing resources as well on the chat function. It's great to see that. So as I said, we're going to have a break now for 10 minutes. We're going to come back at past. As I said, when we come back, please do be prepared to kind of come on the screen. You don't have to turn your videos on if you don't want to, but we will kind of make it possible so you can, and so you can unmute yourself, and you can join in the conversation directly with each of our speakers, because all four of our speakers are going to come back onto the panel session at the end. So I'm going to say goodbye now, because when we come back after the break, Jürgen is going to take over as the chair, and I'll just be in the background doing any facilitation that's needed. So thank you very much indeed for our two sessions, and to everyone else, and we shall look forward to seeing you in 10 minutes after another cup of tea and maybe a packet of crisps this time. Thank you very much, everyone. See you in 10 minutes.